Good afternoon, everyone. I'm Lynn Vedeka, Dean of the University of Michigan School of Social Work. It's my honor to welcome you to part 2 of the 2020 Fedele F. and Iris M. Fauri Memorial Lecture. Due to the pandemic, this year's format has been 2 panel presentations over 2 dates. Part 1 was hosted on October 14th. It addressed how the COVID pandemic has brought increased focus on enduring challenges and emerging concerns with the child welfare system, along with implications for policy and practice. Today's session will provide an opportunity to hear from and engage with 3 eminent experts in the areas of child maltreatment, foster care, and child welfare reform. Our own Professor Joe Ryan, who has won the U of M campus's top award for the public impact of his research on the welfare of the most vulnerable children in Michigan, will moderate the session. Ju-Yun Chung, Senior Deputy Director of Michigan's Children's Services Agency, and Alan Detloff, the Maconda Brown O'Connor Endowed Dean and Professor at the University of Houston Graduate College of Social Work, will present a proposal to shift to a more preventive-oriented system of care and a proposal to reinvent child welfare. If you missed part 1, it can be viewed at the School of Social Work's website. Now a few words about the event and the founders of the event. This special event is presented annually in recognition of former University of Michigan Vice President and the first Dean of our school, Fedele F. Fauri, and his wife, Iris. This event celebrates Dean Fauri's leadership in the field of child welfare. Much of today's social welfare legislation at both the state and federal levels is a product of Dean Fauri's activities over his 50-year career. First as director of the Michigan Department of Social Services, and then during his years in Washington, D.C., where he held numerous leadership positions. Dean Fauri's accomplishments in child welfare and social work education brought national and international acclaim to the School of Social Work and to the University of Michigan. This annual event is made possible by gifts from the Fauri family, from alumni and friends, and it's designed to serve as a forum for discussing ideas and proposals to enhance the well-being of young people. Professor Joe Ryan from the University of Michigan School of Social Work will moderate today's session, and I will now turn the program over to Joe. Joe.
Thanks, Lynn. Good afternoon, everyone. Good morning to some of you, if you're out west. And welcome and thanks for joining us. The pandemic has turned our world upside down, but will not prevent us from gathering to exchange ideas. We will adapt and move on. So I'm excited and honored to introduce our guest speakers for today. We'll have our 2 speakers, so a speaker and then some Q&A, another speaker and then some Q&A. Our first speaker is Ju-Yun Chang. Ju is the director of our Children's Services Agency here in Michigan, which is our child welfare system, but also has oversight over our juvenile justice system as well. You might say a few words, but this might be about month 6 or so for Ju in this leadership role. We're very fortunate to have her here in Michigan. Prior to taking the director's position, Ju was with Casey Family Programs as managing director, was a senior staff attorney with the Children's Defense Fund, was appointed by President Obama as an associate commissioner in the Children's Bureau. Is a lawyer by training, but you gave a talk in my class last night, and it turns out she's quite a historian as well, talking a little bit about sort of the history of child welfare So her knowledge of child welfare systems, the experiences of children and families is quite broad. Our second speaker is Alan Detloff. Alan is a professor and dean in the School of Social Work at the University of Houston. His background is in CPS, child protection, as a child protection service worker, and then as a supervisor. His scholarly interests focus on issues of racial disproportionality and disparities in the system. And he actually gave a talk at a conference we hosted about 5 or 6 years ago on immigration and child welfare reform. So he's been at this for quite a while. So those are our speakers. Before we begin, if we could move to the next slide, would be great. I'd just like to set the context for our discussion today. When we look at the risk factors that may compromise or challenge things like effective parenting, economic stability of families, the disruption of systems that we've built to protect children and keep children safe. During this pandemic, we find that alcohol sales have increased by 55% early on in the pandemic. Unemployment hit 24% in Michigan by April. Students from the public schools were sent home for remote learning. Teachers, who are one of our most frequent mandated reporters, no longer reporting suspected cases of maltreatment. Ju will speak, I think, a little bit to the changes in the front end of the child welfare system. The health consequences of COVID-19 were disproportionately experienced by African American and poor families. As of May 2020, African Americans comprised 14% of the population in Michigan, yet accounted for 33% of COVID cases and 41% of COVID fatalities. So the pandemic, although it's turned all our worlds upside down, the effect is not disproportionately shared, is not equally shared by all. So questions: how is this pandemic impacting child welfare systems? How can child welfare systems best respond? These are some of the questions that we will be exploring and hopefully getting answers to today. So I think if we could move to the next slide. So before we start, just to get a sense of who is in our audience today and to get a sense of your areas of interest, if you could answer 2 of the poll questions, they should emerge right on your screen. Who's in attendance? Are you a practitioner, researcher, student, other? And then which is sort of the most interest with in terms of your own areas of interest, child welfare research, child welfare practice, policy, or all of the above. And once we get that, we will transition and welcome Director Chen.
All right, we have responses coming in. It seems like most folks are figuring it out. Again, I just wanted to remind you, this is our first poll. If you're not able to respond to the poll in the Zoom platform, you're welcome to respond in the chat. Looks like we've hit kind of a point here. So I'm going to go ahead and end the poll. So Joe, here are our attendees.
Great. So about 54% practitioners, 9% researchers, 4 students, and 33% others.
Okay, I'm going to run the next poll now.
Okay. And you can click all 3 if all 3 are your areas of interest.
All right, this one's going a little quicker because people have figured it out. All right, let me give it one more moment.
So I see we have about 100 participants today. That's great. Thanks for everyone making time. It looks like folks are interested in all of the areas. 57% child welfare research, 83% child welfare practice, 75% child welfare policy. Great. That gives us a sense of who's here. And now if I could, we could transition in, zoom in, Director Chang, that would be fabulous.
All right, great. Thank you so much, Joe. Thank you for the invitation to join you today. I want to thank Dean Fedele for hosting this really important conversation, and I'm thrilled to be a part of the panel. I'm so sad that I won't be able to stay to listen to Dean Detloff's presentation, but I am so intrigued. I hope that I can follow up with you and learn more about your work. Particularly because as I talk about Michigan's impact, the impact that COVID-19 had on Michigan's child welfare system and how we responded to that, it's really important to remember that that response was really built on a year's worth of work that we've been doing in the agency to try and really transform our child welfare system. From one of reaction to one of proactive work, from one of family separation to one of family strengthening through the availability of prevention and early intervention services. And so, you know, through the ability to rely on data analysis that we had done about who is at risk of abuse and neglect, before they even come to our attention through calls to the hotline, we were able to really respond, I think, in a nimble way. And so we are really fortunate in that regard. But why don't we just jump into the information? So if we go to the next slide. Oh, I'm sorry, there's a poll question. I totally forgot about this. Do we need to go back? And yep, the poll question says, at the start of the pandemic, with children staying home and unemployment rising, what did folks expect around maltreatment reports to increase, decrease, or stay the same?
All right, so those are coming in pretty quickly. I'll end the poll in just a couple seconds and share those results so we can all see.
All right, so we have a really informed group of participants. That is in fact what we saw. We saw a pretty significant decrease in the number of calls to our hotline. This poll is showing that 61% of you thought there would be a decrease, 39% of you predicted an increase. And if we go to the next slide, what you will see is that when the state went into our stay-at-home order or our shutdown order, which included the closing of schools, we saw an immediate impact on the number of calls to our hotline. Each year, we get approximately 200,000 calls to our abuse and neglect hotline. And as you can see, that means that in any given week, we receive anywhere from 4,000 to 7,000 calls. We saw the number of calls drop by 50% on average immediately. And what you'll see in the next slide is one of the primary drivers. Our stay-at-home order or state shelter orders were pretty comprehensive. Kids were not going to school. Really, it was you should be in your home unless you absolutely have to do activities outside your home, for instance, getting food, or if you were an emergency worker working in the hospitals or in law enforcement. And so there was a very small group of people who were doing work in the public or were in fact interacting with others outside of their home. And so what you see is that almost as soon as the stay-at-home order went into effect, we saw a significant decrease in one of our greater stakeholders that tend to make calls into our hotline, and that's school personnel. So that's that brown color at the top of the graph. And as you can see, the distribution of who calls changes a little bit with increases in groups like relatives, law enforcement, and medical personnel. If you go to the next slide, we'll see what impact that had overall on our system. You can see that we started to see a pretty steep decline in the number of children entering our system in April, when we had about 30 days, which is the typical amount of time we have to complete an investigation, and therefore we saw the impact in late March of the drop in calls to our hotline. That decrease was pretty steady, with a couple of bumps here and there. You'll see there's a slight increase in the early summer months, possibly due to a lot of media attention that stories about drops in calls received, perhaps some loosening of the stay-at-home order. We see kind of a steady drop again through the summer months. And then you see that those entries pick up again in early fall, as many of those stay-at-home orders were rolled back. Interestingly, we also saw a decrease in the number of exits from our system. And so because these two drivers, exits and entries to our system, are important markers of how kids are doing, how we are doing as a system to get them back with families, these two markers became things we paid a lot of attention to and tried to create remediation strategies for. So if we go to the next slide, I'll start at the very beginning when we had our stay-at-home order. Again, as our governor made clear, only those essential workers were allowed to continue to do their work out in the field, and only because that work was absolutely necessary to the health and safety of Michiganders. And so we really thought about, what does that mean for our staff who do their work primarily in the field? We knew that there were some workers who needed to continue spending time in the field, but not necessarily all of our staff, right? We have a combination of CPS investigators, we have ongoing in-home caseworkers, foster care workers, adoption workers, et cetera. And so we needed to be really specific about who was essential for maintaining safe and health of our citizens, and whose work could not be done remotely. It became clear to us that there was at least one group of staff who absolutely needed to continue doing its work and could only do its work in the field, and that was our CPS investigators, and to a small extent, our in-home caseworkers, and obviously any kind of cases about a foster child who maybe needed to change placements, right? But those were rare events. We knew that we could predict there would be investigations, but at the same time, we didn't necessarily need to send all of our investigators out into the field because we knew that the volume had decreased so significantly. At the same time, some of you may recall that when this pandemic began, we were in a really different situation than we are now, as states kind of experience a second or third surge in the number of cases. When this began, we did not have enough personal protective equipment to even protect our hospital workers who are on the very front lines of our system. And so certainly you can imagine that our state was struggling to make sure that all of our essential workers had access to even the basics of masks, gowns, etc. So knowing that we had a shortage of PPE and recognizing that we had a decrease in the volume of cases, and also recognizing that this was a new circumstance, we needed to make sure we took safety precautions even when we were going out into the field. And we knew that trying to train everyone who may be going out less often was less effective than training a core group of staff who would be dedicated to maintaining all of our field work and would be able to then be covered with a limited personal protective equipment that we had. So we developed these field team workers. It was done on a voluntary basis. We were able to reduce our footprint in the community, which is also important, by nearly half. At the end of the day, in the beginning, it was about 20% of our CPS staff who volunteered to work in the field. They were specially trained. They got the personal protective equipment, and they did any face-to-face contact required. Most of those were investigations, but there were also contacts for ongoing cases, foster care cases, other safety-related issues, and placement change requests. We go to the next slide. Another factor that we really wanted to make sure we were keeping in mind was the safety and well-being of older youth in our system. So one of the programs that Michigan has taken advantage of for many years is extending foster care to age 21 for young people who would have otherwise aged out at age 18. Now that is a federal program that we have participated in, and that federal program has eligibility requirements that we cannot otherwise waive, including certain requirements that around either being enrolled in school, in some type of vocational program, or being employed, or having some kind of medical reason why they can't do any of those activities. We have a relatively high rate of enrollment into extended foster care, but only as compared to other states. We're at about 1 out of 4 kids who age out will enroll in this extended foster care program. We know that's due to a lot of reasons, but one of those is that they may not be eligible because of those criteria. We wanted to, knowing that because of the pandemic, that not only were our kids struggling to find employment, but that there may be issues related to schools closing. And so some of those requirements were no longer options. And so we did a special outreach that reached all of our young people who were still age eligible, and let them know that we were waiving any requirements so that they can enroll and ensure that they got their needs met. This was also important to us because some of these young people who aren't typically enrolled in our extended foster care may just be getting by couch surfing or relying on others to help them. But knowing that everyone in our state was stretched, we knew it made them even that much more vulnerable. We didn't want them to have to rely on homeless shelters where we were concerned about outbreaks of COVID. And so this was really important for us to make available immediately. The next slide shows how we also partnered with that group of folks who were not able to report to us, educators, right? Now, not only did we immediately see that they were sending us fewer reports, but educators reached out to us expressing concern about the fact that they weren't able to put their own eyes on children who they had been concerned about, but maybe were no longer able to see even in remote classrooms, or as they offered up free packaged lunches in the communities. And so we really talked to them about, what does this COVID experience give us an opportunity to do? And one of those things was to really help to partner with our educators to think not only about CPS as an agency to get involved with children at risk, but to really help our partners understand that keeping children safe is everyone's responsibility. And that includes educators, that they can do more than call into the hotline, that they don't have to wait until things get so bad that that call is mandated, but that there are things that they can do when they see some risk factors or are feeling those concerns. We created a guide that helped them understand what questions they might ask of children and families when they do interact with them, to understand risk better, but also to see if there are other supports that they might be able to offer to those families, including services related to substance use disorders, domestic violence, things that we know are drivers into our system. And we made this available to all the Michigan public school systems. We developed this in partnership with our school superintendent. So then if you go to the next slide, we have our next polling question. Emma? Okay, so I think this question asks, what are the highest areas of need for families? If folks could choose, I may have given a bit of a hint.
All right, looks like they're coming in pretty quickly. I'll give you guys a couple more seconds. And real quick, while we are waiting for those answers to come in the chat, someone is asking where they can find the guide that you were just discussing.
Sure, it's on the MDHHS COVID website, but if it's possible, we can send you a link afterwards.
Yeah, absolutely. Okay, so ending the poll, and here are the results.
Great. So the next couple of slides will show what we learned were the needs of some of our families. That guide that we developed in partnership with our Department of Education really inspired us to actually take action ourselves. We knew that there are a certain group of families who come to our attention on multiple occasions. Maybe the first or second time, their level of risk does not rise high enough to require foster care or even in-home interventions. But because of that research I shared earlier that we were doing in preparation to transform our system to a more prevention-oriented system, we knew exactly what characteristics those families had. And we knew that a certain percentage of them would be coming back to our system if all things remained the same within 1 year, and that their needs would have escalated to the extent where they would have actually needed foster care within 12 months. And so we knew that because calls were not coming in, some of those families were invisible to us. And although as you can probably all remember that in March and April, the pressure and the level of unknown could feel really overwhelming, we thought it was important to actually take some proactive action in a concrete way. And so we said, okay, maybe we can't reach all 30, 40,000 families who might have otherwise been called into the hotline, but we can identify maybe 12,000 families, 14,000 families who we can predict would have come back into our attention within 12 months. And so we looked at 6-month prior history. We looked at all the families who met the criteria of being at higher risk for coming back to our attention. And rather than waiting until after COVID to capture their calls to the hotline, we decided to be proactive and to reach out to all of those families. We trained our CPS staff to really rethink the way that they're doing their work, from one of investigation and looking to find evidence of abuse or neglect, to being a helper, to put their helping hat on, and to think about what is it that families need and connecting them to services. We localized that educator's guide so that whenever a staff member called a family, they knew the number for the DV hotline, the DV service provider in that community. We reached out to over 14,000 families, and we gave ourselves a time limit. This wasn't something that we knew that in order to motivate our staff and to learn from this, we needed to do this work quickly. So we gave ourselves 30 days to reach these families. We reached 80% of them either through an actual phone call, a text message, email, or we sent them a package. And one of the things we asked them was, if you need something, what is it that you need? And if you look at the next slide, you can get a sense of, in fact, what our families said that they needed. A lot of families actually said that they didn't need it. Now, maybe they were afraid to share what they needed because we are still, in fact, the child protective system. But many of them talked just generally about support they needed. Maybe they lost their benefits to cash assistance or food and nutritional assistance. We help them bridge the gap in those instances. And then the next slide shows you the types of services that we were able to connect them to based on their request for more help. The next slide, I'm going to go through kind of quickly the next several slides just because I know we're running low on time. We did a second outreach this fall as we recognize that families, we may now have a new group of families that we needed to reach out to. We identified 10,000 plus more families who met the risk criteria, and we were able to reach a little over half of them this go round. If you go to the next slide. These are the needs that were requested in the second outreach. And I do think it's really interesting that some of the needs that were identified in the second phase of our prevention outreach program shifted a little bit, right? There's a lot more requests for housing and mental health assistance. Again, not surprising, but I think it is important for us to track those variations. All right. Next slide, please. So I won't go over these, but I can tell you that this experience was greatly appreciated by our staff, the opportunity to talk to families and to play a different role from their traditional CPS role to the role of family strengthener, family helper. I see all the notes about the sound. I apologize. I know that it's not working very well, so I will try to get closer to my microphone. And so these are just some examples of the stories that we heard from our staff. Go to the next slide. I want to talk about the other end of the continuum that I mentioned that we were paying very close attention to, and that's exits from our system. We know that all forms of exits, whether it was reunification, adoption, guardianship, were slowing down during COVID, but recognizing that the vast majority of our kids who exit the system exit to reunification, and that those are often some of the more complex court cases. We decided to take action again within a 30 to 45 day window of time to try and move children who were close to reunification back home and to try to overcome those barriers through partnerships with our state court administrative office, with lawyers and caseworkers. And we identified a group of kids who we thought were very close to reunification. The proxy measure that we looked at for appropriateness or reunification was not only having a case plan goal of reunification, but having had a period of unsupervised in-home visits approved and used before the COVID shutdown, so that we knew some of those safety issues had been addressed. If you go to the next slide, what you'll see is that we were in fact able to get 69% of the 432 cases identified for rapid reunification unified within that 45-day period. We continued after that actual project period of time to track these cases and to continue to move to resolve any of the issues that left them from exiting our system. And then the next slide will just show you some of the reasons that we learned. There were a number of reasons for what barriers were. And then the last couple of slides that I want to share is that we realized that as a big child welfare and juvenile justice system, that we were making lots of really rapid fire decisions as information about health and safety became available to us on a new pandemic that we were all adjusting to. We had to make some really quick policy decisions regarding visitation, around safety of visitations. And yet there were so many different people who were impacted by those decisions, including parents, bio parents and foster parents and relative caregivers who may not be part of our regular communication chain. And so we worked really hard to try and to enhance our communication capacity, often through town halls with specific audiences. I will say we probably still have a long ways to go to improve how those, how that communication is shared effectively, but these were some of the ways that we try to do that. And then the last slide just gives you a sense of why it was so important for us to really focus on over communication, because this just gives you a sense of all of the policy changes and executive orders just on child welfare and juvenile justice alone during these last 6 months. And with that, I think that concludes my presentation.
Okay. All right, we have some questions. Are you ready?
Ready.
Okay, so the first one that I am going to give you, are there certain areas of Michigan that have more needs?
So I guess I'll answer that by saying yes, there are certain pockets, certain zip codes, certain regions of our state where there are higher rates of entry into our foster care, higher rates of calls into our system. And so, yes, we did focus in on those areas, but you know, some of the geographic areas where we have some of the highest rates of entry into our foster care system are actually in areas where they're quite rural, not as many total number of children, but maybe the reason they have a higher rate of entry is because they have very limited access to prevention and early intervention services. So it's a bit of a mix.
Okay, our next question, has COVID impacted any staffing issues? Did it increase turnover or risk of burnout and stress?
Well, I mean, I think it certainly increased burnout, especially among the staff who had to go out into the field. Those field team workers were heroic, and we were able to provide them with a pandemic enhancement in their pay for some period of time, but not for the whole time that they did that work. And that was difficult. We also, I think, had those staff in central office who were drafting those policy guidance or new communications for the community, you know, working every day, you know, at least 12, 14 hours a day in the beginning. It was really tough. But, you know, we had some of the most, at least in our public agencies, some of the greatest stability in our workforce, the least amount of turnover that we've had in a long time. So I think, although it didn't cause us to have instability in our workforce for lots of reasons, I'm sure, there was a lot of stress and I think close, if not actual burnout among some of our staff.
Okay, I know you have a hard stop coming up, but we have a couple more questions I hope we can get through. So one participant, she says, I train community groups on being prepared and planning and practicing for any and all emergencies, including pandemics, natural and man-made disasters. It baffled me as to why cities and states were not prepared for essential workers. Are we better prepared now for any emergency or pandemic?
You know, I mean, I can't answer that for others outside of our agency. I think that we are better prepared today than we were in March. All
right. We have kind of a specific question. Is there an option of temporary respite for a 10-year-old involved with the juvenile justice system that needs some time away from her family to prevent the home situation escalating to a CPS referral?
Yeah, so I'm not going to answer any particular case questions, but I will actually respond more generally to one of the emerging needs that I think we are experiencing as a system at this stage of the pandemic. Just as I noted that families have different needs, we are seeing that ripple its way throughout our system. So in the beginning, we paid really close attention to which foster homes had beds, which foster families and residential providers would be willing to take a child if they were actually exposed or COVID positive. So those were some of the questions that we asked. We surveyed families and said, what additional help do you need? Cash, respite, gift cards for, electronics for your kids so that they can learn remotely. We asked them those questions in the beginning. And I think we are now facing a different crisis that isn't directly related or controlled by child welfare, but by so many other systems that have been put on hold or whose ability to serve has been compromised. So primarily, I think it's mental health and other kind of social service kind of safety net programs. Many of those programs are still not fully operational back in the field, and certainly for several months early on, we're not employed at all, or simply working remotely. You add to that schools who either were remote for a long time or still working remotely. I think there is a group of our children and therefore their families that are really struggling, and those are families where there are behavioral health, developmental disabilities, who are not right now and have not been able to, for a significant period of time, been able to access respite through schools, through special education programs, and cannot access the actual mental health services that they need in the community as well. And that has created such a pressure point on our families who are at the door of the JJ or child welfare system, and it has created a pressure point for our foster parents and relative caregivers who had been doing such extraordinary work to care for these kids, but with all those additional supports now not in place, they are also reaching a breaking point. So we're going to actually be doing a new survey for all of our caregivers to try and get a sense of the scale of that problem. But, respite care is very challenging to come by. We can't even find them for our foster homes who are saying, if you can't get this to me, I can't, continue caring for this child. So that is absolutely a need. And my staff are telling me that I'm late.
Yeah, I know. I want to be respectful of your time. So thank you, Director Chang. And any questions that we have left over, we can use them in the end.
Thanks, Ju.
Thank you so much. Good luck, everyone.
So are we transitioning now to Alan, right?
That is correct.
So that was great. Hopefully folks picked up a lot of information about how the child welfare system is being impacted by COVID. I don't think it's a unique experience here just for Michigan. I think some of the patterns that and trends that Director Chang had presented are seen in other states and being experienced by other systems. It makes you wonder whether or not there will be some lasting improvements to the system, actually. And I noticed someone put that in the chat, that whether or not there'll be these lasting improvements from the pandemic, things like expedited reunifications or just changes in how we do child welfare practice that will actually remain as part of the system and maybe improve the outcomes for children and families. And I think that brings us to a nice segue for Alan Detloff's presentation. So Alan is giving another talk right now in Michigan at the NASW conference. So he recorded his remarks and slides. And so we're going to watch those, and then he's going to zoom in for live Q&A after the after his video ends. So as I mentioned earlier, Alan is a professor and dean at the University of Houston's College of Social Work. His work is largely focused in areas of racial disproportionality, overrepresentation of children of color in the foster care system, and is working on some new ideas to think about reimagining or reinventing our child welfare system. So he'll talk a little bit about issues around disproportionality, overrepresentation, and then ideas on how we might reimagine the child welfare system. So with that, we will get started with his video presentation and then return for some live Q&A. If you have trouble with the audio hearing or seeing the video that's playing, you shouldn't, but if you do, there'll be a link in the chat that you can click and watch it outside of the Zoom presentation.
Good afternoon. My name is Alan Detloff. I'm Dean of the Graduate College of Social Work at the University of Houston, and I'm here today to talk about the Upend movement, which is a movement that seeks system and reimagine how we as a society care for children and families. So I'm going to share my screen and get my slides up, and we'll get started. I thought I'd start by telling you a bit about my background. I began my career as a social worker, working for the child welfare system. I worked in the Dallas-Fort Worth area of Texas, and I specialized in conducting child maltreatment investigations. So I worked as a child maltreatment investigator for about 5 years, and in my last year in the system, I supervised a unit of maltreatment investigators. After I left the system to pursue a career in academia, I started to study racial disproportionality, or the overrepresentation of children of color in the system, and was very involved in Texas efforts to address disproportionality, which was around the mid-2000s. And I've continued to study racial disproportionality and strategies to address disproportionality. So much of what we'll talk about today will be based on research that I've been involved in, as well as other research related to this issue. So to get started, I thought it would help to kind of frame the issue of what we're going to talk about today. Racial disproportionality, or as I mentioned, the overrepresentation of children of color, has been observed in the child welfare system for over 50 years, but persists as a national problem. Prior to the last 10 years or so, there was generally a consensus that racial disproportionality in the system was the result of racial biases that occur in the system. In more recent years, there's been a lot of debate about the factors that cause disproportionality. And because there's debate about the causes of disproportionality, there's been debate about the strategies we should be using to address disproportionality. So the result has been that many efforts to address disproportionality have stalled, and what we've known has been a problem for 50 years remains unresolved. The concern is that disproportionate involvement of children of color in the system causes disproportionate harm, and the failure of the system to address the problem perpetuates that harm. So given the inability of the current system to address that, we believe, those of us involved in the Upend movement, that it's time to consider a new framework that reimagines how we care for children. So today, we're going to talk about what we know about racial disproportionality and disparities in the system. We're going to review some of the evidence of the harm that results to children and families from child welfare intervention, and specifically the disproportionate harm that results to Black children and families. And then we'll introduce the Upend movement and why we believe that abolition is necessary to end the harm that results from child welfare intervention. So to begin with some definitions, racial disproportionality. Disproportionality in basic terms refers to the state of being out of proportion. In the child welfare system, disproportionality happens when the proportion of one group in the child welfare population or children in foster care is proportionately larger, meaning overrepresented, than the same group in the general population. And disproportionality has most significantly impacted Black children, who represent about 23% of children in foster care, although they represent only 14% of children in the general population. But racial disproportionality also exists among Native American and Latinx children, but to a lesser degree and with some variations by state. We'll go ahead and take a look at some data here. Here you can see Black children are represented by the blue bar on the bottom of this chart. And as I mentioned, there are 14% of children in the population, 21% of removals, and then 23% of children in care. So you could see how their representation rises at each of those stages. For white children, who are the green bar, for Latinx children, who are the yellow bar, you could see they start out, white children 50%, but only 44% of children in care. Latinx children, 26% of children in the population, only 21% of children in care. At the top, you could see a small light blue bar. That represents Native American children, who represent 1% of children in the general population, but 2% of children in care. So Native American are also consistently overrepresented in child welfare systems. Here you can see that for Latinx children, when we look at the national level, they're underrepresented, but Latinx children are increasingly overrepresented at the state level. As of 2018, Latinx children are overrepresented in 20 states in the country, whereas Black children are overrepresented in 46 states in the country. Racial disproportionality exists because of racial disparities that occur at both entries into the system and exits from the system. So in contrast to disproportionality, disproportionality compares one group of children, say Black children in the population, to the same group in the child welfare system. Disparities look at differences between Black children and white children at different outcomes of the service delivery system. And we know that beginning with the point of initial referral, Black children are more likely than white children to be reported for maltreatment, to be confirmed or substantiated for maltreatment, to be removed from their homes and placed in foster care. And Black children are also less likely than other children to exit to reunification and spend longer time in foster care. So it's these disparities in both the way that children come into the system and the way that children exit the system that result in disproportionality. So why do racial disproportionality and disparities exist? Initially, as I mentioned, there was general consensus that racial disproportionality existed because of racial biases in the system. As we've come to understand, bias exists in many of the systems that we as social workers work in the criminal legal system, in the mental health system, in the health system, in educational systems. But in recent years, there's been a debate as more and more research has come out showing the connections between poverty and maltreatment. The debate hinges around the issue of whether disproportionality results from what some scholars have referred to as disproportionate need among Black families, or from racial biases in child welfare systems. And we know that research actually supports both of those views. There's much research that shows a connection, a strong connection between poverty and maltreatment. And we also know that Black families are more likely to live in poverty than white families. So there is a connection between poverty and maltreatment that supports disproportionate need. There's also a large body of research that shows that racial bias continues to exist in child welfare systems and impacts decision-making. But what's happened is that those who have contended that disproportionate need is the strong or primary contributing factor have been very critical of efforts to address issues of racial bias in the system, and have said that racial bias does not exist in the system, and as a result, any kind of efforts that look at anti-racism training or cultural responsiveness training shouldn't be used in child welfare systems. And so then the result has been that there's been confusion in the field about how to address disproportionality. And many people have been led to believe that the factors that contribute to disproportionality occur largely outside of the child welfare system. So then there's nothing for child welfare systems to do to address disproportionality. Disproportionality is expected, essentially, and things like anti-racism training, trainings to address issues of racial bias don't need to be done. That's the current state of this debate. Let's briefly look at what we know about why racial disproportionality exists. And there's been basically four predominant theories based on the available evidence that we have. One, as I mentioned, disproportionate need. There's certainly research that supports that. Racial biases among child welfare staff, among mandated reporters, as well as institutional racism in the form of child welfare policies and practices. Child welfare system factors, things like turnover, lack of training, lack of resources to address the needs of families of color, and then geographic context, which mostly involves neighborhood conditions of concentrated poverty that can be risk factors for maltreatment. So you can look at this as things that occur outside of the child welfare system and things that occur inside the child welfare system. What we know, though, is that all of these factors result from a common underlying factor, and that's structural and institutional racism, both in child welfare systems and outside child welfare systems. We could take a look at how that looks here. When we think about external to the child welfare system, we have to look at this through a historical lens that began with the kidnapping and enslavement of Africans going back to 1619, forced family separation that was used as a means of control over enslaved Africans. And then after slavery, laws and policies that were developed over decades, over centuries really, to maintain white supremacy. So things like the Black Codes, Jim Crow laws, redlining, the way the GI Bill was implemented, all of these things have led to many of the conditions that create risk for maltreatment. Poverty, we see a significant wealth gap between Black families and white families. Health and stress, we've seen much research come out in recent years that shows a direct connection between the experience of racism and physical health, declines in physical health. And then geographic context, as I mentioned, things like redlining, the GI Bill, all of these things have resulted in concentrated poverty in neighborhoods that are largely comprised of non-white populations. So all of these factors here are the factors that create disproportionate need. It's just important to keep in mind that disproportionate need is the result of centuries of racism in America. But then we also know that there's strong evidence that racial bias exists within child welfare systems. These are some studies here that I was fortunate to be involved in as part of the Texas work to address disproportionality. Texas was under a state mandate to address disproportionality at this time. And so what we did is we looked at all of the cases that were investigated in Texas between 2003 and 2005, over 176,000 cases. And we looked at disparities at two decision points, the substantiation decision and then the services or removal decision. And then in that services decision, we looked at the need for intervention, whether the case could be closed or opened for some type of intervention. And then of cases where there was the need for some type of intervention, we looked at disparities in the removal decision or the decision to provide services in the home. What was important about these studies is that we were able to control for family income, so we were able to control for the effects of poverty, as well as caseworkers' assessments of risk. So we were able to hold a lot constant, and particularly poverty and risk, to look at the extent to which race impacted the decisions that were made. And what we saw is that when controlling for both poverty and risk, Black children were 15% more likely than white children to be involved in a substantiated case. And then when controlling for poverty and risk among just maltreated children, Black children were 20% more likely than white children to be involved in a case that was deemed necessary for services. And then of those cases that were deemed necessary for some type of intervention, Black children were 77% more likely than white children to be removed in lieu of receiving in-home services. And again, we were controlling here for poverty, for risk, for many other factors, and the race of the child was the predictor of these decisions. I think it's also important to look at these risk assessment scores because this was a really interesting finding. What we saw is that in removal cases, in both high income and low income cases, Black families were consistently scored as having lower risk than white families. You can see here, Black families are the dark green bar, white families are the lighter green bar. And this is the risk assessment score that was given by caseworkers. At that time, Texas used a Likert scale type risk assessment where families were assessed according to 7 different risk categories on a Likert scale of 1 to 5, with 5 being extreme risk, 1 being low or no risk. So the maximum risk assessment score was 35, the lowest was 7. And you could see here in that both high income and low income cases, Black families were consistently scored as having lower risk than white families. But we know from the prior slide that Black families were 77% more likely than white families to be removed. What that tells us is that decisions were made for Black families at lower levels of risk than would be made for white families, meaning that for white families, the risk had to be significantly greater for a caseworker to make the decision that a removal was necessary. So again, these are things that we believe are strong evidence of bias impacting the decisions within systems. So we know that Black children are overrepresented in child welfare systems. We know that that results, at least in part, because of bias in the system, which means that there are children in foster care who don't need to be in foster care. There are children in foster care that are there because of biased decision-making. Why is that a problem? Because disproportionate involvement in the child welfare system causes disproportionate harm. When we look just at family separation, the initial act of separating children from their parents, there is an entire body of research that shows that the act of forcible separation of children from their parents is a source of significant and lifelong trauma. We know that that trauma is associated with things like cognitive delays, increased aggression, poor educational achievement, hypertension, difficulty sleeping, obesity, diabetes. So the act of separating children from their parents is known to cause significant and lifelong trauma. But then following that, we know that children who spend time in foster care are more likely to experience a host of adverse outcomes. We can look here at just a few of the studies that have specifically compared children who were removed from their homes to children who had experienced similar forms of maltreatment but remained at home. And we know that children who were removed from home had a host of adverse outcomes, including higher delinquency rates, higher teen birth rates, lower earnings as adults. Children who were removed were twice as likely to have learning disabilities, developmental delays, substance abuse disorders, more likely to have criminal convictions for violent offenses. And these are just some of the studies. There is an entire body of research that shows that children who spend time in foster care, children who age out of foster care, are more likely than other children to experience many of these adverse outcomes. Those risks exist for all children who enter foster care, but we believe the risk of experiencing these outcomes is exacerbated for children of color due to the ongoing legacy of racism and inequality in America. We know that Black children in America are already at risk of poor outcomes over the course of their lives, including economic hardship, poor health, low educational attainment, criminal legal involvement, emotional distress, suicidal ideation. That's without child welfare intervention. When we then add the trauma of forced separation, placement in foster care, the risk of experiencing these outcomes is increased. So we have a population of children that's already at risk of adverse outcomes, and then we expose them to an intervention that we know causes harm. In that way, the child welfare system itself acts as a source of oppression for Black children and families. Which brings us to the Up In movement that seeks to abolish the current child welfare system. So why upend? Decades of research have documented not only the existence of racial disproportionality, but the harmful effects of disproportionality on Black children and families. And despite decades of attempts at reform to address this, racial disproportionality persists, and the harm that results to Black children and families continues. So given the inability of the system to address this problem, we believe that it's time to look at a new way of supporting, caring for children. And we believe that that needs to start from a foundation of anti-racism. An anti-racist framework means that we look at institutional and systemic policies and practices that produce and maintain racial inequity, and look at ways to undo those policies and practices. So when we apply an anti-racist framework to child welfare, that starts by acknowledging that racial disproportionality and disparities are maintained through the policies and practices of the system in which they exist. So when we look at an anti-racist approach to child welfare work and eliminating racial disproportionality, it means that we want to shift our efforts from trying to reduce disproportionality once it exists, which is what the system has tried to do for decades now, to examining and remedying the policies and practices that create disproportionality. And in the child welfare system, the policies and practices that create disproportionality are the policies and practices that support the involuntary separation and removal of children from their parents. So why upend? Because we believe reforms are no longer sufficient. We believe that eliminating racial disproportionality and disparities and the harm that results will only be achieved when the forcible and involuntary separation of children from their parents is no longer viewed as an acceptable form of intervention. We believe that the harm that results from this, the families that are destroyed as a result, will only end through abolition of the existing system and a fundamental reimagining of how we support child, family, community, safety, and well-being. So the Upend movement is an emerging collaborative movement aimed at ending the use of involuntary separation and increasing supports for families and communities so that they could care for their children in their homes. It seeks to rethink state-sanctioned separation of children as a response to social problems, things like food insecurity, poverty, lack of affordable and safe housing, lack of meaningful prevention services. We know that more than 60% of removals are the result of neglect, and we know that neglect is largely the result of poverty. The Upend movement seeks to address and alleviate poverty as a solution for families, rather than removing children from their parents when they don't have everything they need to take care of their children. Abolition, we know, is misunderstood by many people. The idea seems scary for many people. The important thing to know about abolition and abolitionist work is that abolition of child welfare doesn't mean abandoning the need to care for children. It means building new ways of protecting and supporting families, while at the same time dismantling coercive systems like the child welfare system that surveil and punish families. We know that abolition is a process. Abolition requires that we dismantle racist policies that contribute to inequitable outcomes, while at the same time we're creating new policies and practices that are providing the resources that families need so their children can remain at home. And abolition is about shifting of power. It's about shifting of power from institutions of social control to communities. Our vision for abolition is that when a family is in need, when a family is in crisis, families and communities are first responders rather than the state. So much of the work of abolition is about reimagining. And reimagining is a process of co-creation with community organizers, parents, youth, advocates that build systems of support that enable families to have the access to the resources that they need. It looks at providing things like a universal child allowance, safe and affordable housing, jobs that pay sustainable wages, mental health services, food, domestic violence support, substance abuse programs. And what reimagining looks like is that when we do this, then families will have the resources they need. We know that from a large body of research, just a moderate amount of financial assistance can significantly reduce maltreatment and contact with child welfare agencies. That's what our goal is. Again, I mentioned neglect cases before. Right now, in neglect, we remove children from their parents when we deem them to be neglectful, and then we put their children in the home of a stranger. And then we pay that stranger money to care for someone else's child. In Texas, we pay foster parents around $700 a month. What if we just gave that $700 a month to the parent who's struggling to meet their child's needs? That would eliminate the need for foster care to begin with. So that's what abolition is about. It's about working to create a society where the use of foster care is obsolete. I'll close with this quote from Ruth Wilson Gilmore, a prison abolitionist, who says that abolition as a way of seeing. Abolition makes you ask, when you look, what are you seeing and what would you rather see? Right now, we see a system that disproportionately surveils Black and brown children. We see a system that disproportionately separates Black and brown children from their parents, and then exposes those children to an intervention that we know causes harm. What would we rather see? We'd rather see expansions in existing safety net programs. We'd rather see housing for everyone who needs it. We'd rather see access to health and mental health services. We'd rather see things like universal basic income so that families have what they need to be successful. What we'd rather see is a society where families are strengthened and supported rather than surveilled and separated. That's what the work of abolition is about, and that's what this movement is about. You can learn more about our movement by following us on Twitter at Up in Movement. You can follow me on Twitter at Alan Detloff, and you can see our website at the bottom of this slide is upinmovement.org. So that's the end of this formal presentation, and I'm looking forward to answering any questions that you may have.
Great. So that was fabulous and a seamless Zoom transition. Dean Detloff, who I think was in a presentation in another part of Michigan. And I'm taking it you're back in Houston now.
Yes.
But thanks for joining us. I think Emma is going to ask some of the questions that were posted in the Q&A. Oh, there is a poll that we have to do before this. So if folks can answer, are existing reforms sufficient to address the problems that exist in the child welfare system? And then we'll read out, I think, those responses, and then we have about 10 or 15 minutes for some questions. We have
of time. I'm actually going to give you guys some questions now while we're answering these polls. I think that might work kind of well. So we do actually have quite a few questions. And I kind of want to go back to one. Joe, you mentioned it a little bit in our transition period, but what new programming do you guys think it will continue after COVID is over?
Is that a question for me?
yes.
An overarching question.
In terms of new programming inside the child welfare system or outside the child welfare system, you know, I hope that people are looking at the systems that they're working in now. You know, we've all heard many things about reductions in hotline calls, things like that. So I hope that we're able to look and examine is how families are getting what they need right now without intervention from child protection systems. Because as I talked about in the presentation, there are families who are in need of services, families who are in need of intervention, for separation of children from their parents. So I hope that we look at expanding services that involve things like expanding existing safety net programs. I hope we look at using, expanding the use of informal kinship care, expanding access to housing, expanding access to the services that people actually need, rather than having foster care be a gateway to those services. That's the kind of thing I hope we can expand.
I'll offer just a brief thought. I think one of the practices that will stick around is this notion of expedited reunifications. So the notion of when children come in, we don't need to wait around for 3 or 6 or 9 or 12 months for a permanency hearing. But so right now they're doing them sort of virtually. And if caseworkers and families and judges all agree that a child should go home, you don't need to wait 90 days or 120 days to talk about it. And it's, you know, it's crazy and sad at the same time that a pandemic brings up something like that, a recognition like, you know, why are we waiting for another 3 or 6 months when a child could go home a lot earlier.
All right, so I don't know if you guys wanted to respond to the poll at all before I launch the other one.
I think the poll was universal. It just flashed, but I think folks thought they answered no on the reform question.
Correct, yep, 91% answered no, 7% unsure.
Yeah.
All right. Here comes our final poll.
Is abolition a concept you could support with additional education and understanding?
Give everybody a couple more seconds and then I will launch the results.
So while we wait for the result, Alan, I'd be interested in just your thoughts on some of the pushback you probably have received from the idea of abolishing a system designed to protect the safety of children, right? It's I assume there's another side of the debate or other opinions that you've received.
Mhm. Yeah, absolutely. And I think that's why it's important to educate people about what abolition really means. I think the fear comes similar to movements to abolish the police, abolish other carceral systems. There's fear that abolition means the end of foster care tomorrow, and then that means that children are unsafe and unprotected and just being rampantly abused. One, as I talked about in the session, we know that serious cases of abuse and maltreatment, first, are a very small minority of what child welfare systems actually respond to. But second, it's about raising awareness that by abolition, we mean a gradual process of reducing the use of foster care on cases that aren't those severe forms of maltreatment, and thinking through ways of redirecting the funds that are currently used on the maintenance of foster care to families and communities who need it. I can't remember if I said it in the presentation because I recorded it a couple of days ago, but we know from a lot of the literature, you're probably familiar with Christy Slack does, her whole body of research has shown that just a small amount of financial assistance can significantly reduce maltreatment. We want to make investments in that kind of work rather than investing in putting people in strangers' homes.
Great.
Okay, so here are the results from the poll.
So it looks like 75% of folks would support abolition type reform with additional education and understanding. Great.
Great, I'm glad to see that.
Okay, so on to our next question. Under abolitionist system, would you eliminate the mandated child welfare reporting system? As I understand it, it is the best funded element of the current child welfare system. If so, how, where did it go? There it is. If so, how would you identify families in need?
Absolutely. Part of this movement calls for abolition of mandated reporting laws, because we know that mandated reporting laws, one, bring many, many families to the attention of the system that don't need to be involved in the system. And two, we know from a large body of research that this is where a significant amount of bias begins, particularly by professional reporters, by medical professionals, educational personnel. There's a huge amount of bias that occurs at this front end of the system that brings people to the attention of the system. And what mandated reporter laws are what creates the system of surveillance that I talked about that is harmful to families that are under surveillance all the time. If you look at the work of Dorothy Roberts, if you read Shattered Bonds, some of her other studies, she talks about how harmful this continual feeling of surveillance is, particularly in Black and Brown communities, and the oppression, the feeling of oppression that results in. So absolutely, I think we need to get rid of mandatory reporting laws. What I'd replace them with is that there's actually legislation that's being developed in New York by some parent advocates that wants to replace mandatory reporting laws with mandatory supporter laws, meaning that when people know of a child or a family that's in need, that needs attention, that they do something to provide the family with what they need. They refer them to services, they refer them to someone that can provide assistance, but there's not a requirement to report them to child abuse hotlines. So I think those kind of efforts are important and an important part of this work.
So would there still be some sort of hotline referral system in place where incidents of maltreatment have been observed and
Yeah, absolutely. There just wouldn't be the fear of losing one's license or losing one's practice if they don't report to that system, because that's what results in a lot of over-reporting and bias reporting.
Okay, so moving on to one of our other questions. Did the race of caseworkers, supervisors, judges, attorney, etc., make a difference at case decision points?
I've only seen a handful of studies that have factored in race of caseworkers. I don't think I've ever seen a study, Joe, you may know, or that included things like race of judges and people outside of the system. I haven't seen that. In the cases that in the studies that I've seen that have included the race of the caseworker, I've seen that the results are kind of inconsistent in how that impacts outcomes. I've seen some studies show that Black caseworkers are more likely to substantiate on cases with Black families. I've seen some studies, I think some that were done in Illinois, Joe, probably when you were there, that showed by Nancy Rolock, Mark Testa, that showed that the race of the caseworkers didn't make a difference. So I think the small amount of evidence that we know about that is pretty inconsistent.
Yeah, I think that's the case. Inconsistent and sort of inconclusive, to be honest. And we see that across other systems as well, juvenile probation, adult corrections. And it sometimes is in contrast or opposite effect of what you might suspect, where African-American probation officers are harder on their juvenile parolees who are also African-American. And the logic is, the explanations that folks come up with is that they understand all the obstacles that are in front of a young African-American, let's say male, involved with the juvenile justice system. And they feel like they have to be harder on that particular child. Rather than, I think that the general thought is, you'll understand that child and you're more likely to give them a pass or just be equal. And I think the literature is sort of very unclear on that. I don't think the race matching would have as large of an effect as people might think it would.
Okay, so moving on, we do have quite a few questions, so I'm gonna keep on rolling. With this sort of clear data outlining the racial bias and harm being done through the child welfare system, why is this system still in place? How is it currently being defended? The data presented here makes it seem indefensible.
That's a great question. And that's part of why we launched this movement. The system has known that racial disproportionality has been a problem for decades. And they've been unable to really substantively, meaningfully do anything about it. There is a whole body of research that shows that foster care as an intervention causes harm. I think there's a myth of this system being helpful for people who don't work in the system, don't understand the system. That's created in large part by media representations when there's a very severe case of abuse or neglect. The media respond, or the Child Protective Services respond, the media deems that newsworthy, and that creates this perception that the system is helpful. As I said, we know that's not the bulk of cases. So there's not, this movement also doesn't have what we can see on TV that is the result of the harm that the criminal legal system or systems of policing cause to Black and brown people. We can watch TV and see the harm that the police have on Black Americans. With this system, we don't have that type of thing. So this myth of the system being helpful continues to exist. We felt that it was important to begin this conversation about abolition for the very reason. We know that there's racial bias that exists in the system. We know the system causes harm to children, and we know there are other ways of doing it. The reason reforms haven't worked is because every reform that's been done has never really been willing to let go of this foundational intervention, which is forcible separation of children from their families. If we can start to reduce and eventually eliminate that intervention, that's when we can start to really help people in the way that they need help. But I mean, it's a good question. Why does the system still exist even though we know that it causes harm? That's the reason why we started this movement, because it still exists even though we have all this information.
Joe, did you want to say anything or should we move on?
Yeah, we only have a couple minutes, and I'd like to hear Alan's thoughts on these questions since he's our guest, so that would be great.
So we do actually have some questions on the upend movement that I'd like to move on to. Is the movement active in all 50 states?
Right now, the movement is very, very new. It's kind of just emerging. So there's not, we don't have things like chapters or anything like that. It's basically a national effort that's starting a conversation about abolition. And it's starting with coalition building with other entities, organizations. We're absolutely not the first organization to call for abolition of the child welfare system. So we want to build coalitions with other organizations, entities, movements that have called for abolition for years, add our voice to theirs, lift up their voices. Many of those organizations are parent organizations, youth who've been involved in the system. So right now, what we're trying to do is create a dialogue about this, particularly within social work circles, within conversations with researchers, social work practitioners, and educate people about, raise awareness of the harms of the system, raise awareness about racial disproportionality. As I mentioned in my presentation, conversation about disproportionality has really waned in recent years. And I think it's important that we continue to have those conversations. So this is partly right now a national effort in terms of coalition building, presenting like this, getting people who are watching involved, getting people to go to our website, it's upinmovement.org. You can follow us on Twitter at upinmovement. The reason that we call this a movement is because all of you who are interested in this are part of the movement. We want to build the movement together and then collectively create opportunities for us to get together and develop more specific and concrete plans about the road to abolition, how we're going to get there.
Okay, I'm going to throw one more question at you. Does the movement consider cultural factors when supporting families?
I think if I'm understanding the question right, absolutely. I mean, the movement is built around this concept of anti-racist practice. Anti-racism requires that we consider cultural differences in the development of things like intervention practices, policies, because all of the practices, policies that are developed through an anti-racist framework are developed for the purpose of achieving racial equity. And so we know that these cultural factors are part of that. So yes, absolutely.
Okay, so I know there are still some unanswered questions in here. Joe, if you have some time to just type a few answers to some of them. But that is all we have time for today. I want to be respectful of everyone's time. And if either of you have any final thoughts, please go ahead and say them now.
Just thanks for everyone for joining us today. Alan, thanks for your time. I know your schedule is pretty pressed. I think it's great to hop on and exchange ideas with folks. And so it's been fabulous. Thanks, Alan.
Thank you. I appreciate the opportunity to be here today.